Hi, this is Amanda Lawton, Indiana State University LPN to BSN student for Community Health Nursing for Health Education Project number 5, discussing hypertension in children. Upon completion of this video, the viewer will be able to identify 3 causes of hypertension in children, identify 8 risk factors for childhood hypertension, identify 7 symptoms of hypertension in children, identify 7 treatments for hypertension in children, and identify 3 preventative measures for hypertension in children. Please stop here for a moment to take a pretest to assess your knowledge of hypertension in children. The link is provided in this slide. High blood pressure or hypertension in children is blood pressure that is at or above the 95th percentile for children who are the same sex, age, and height. There isn't a simple target range for high blood pressure in all children because what's considered normal changes as children grow. The CDC found that more than 1 in 7 U.S. youth ages 12 to 19 had high blood pressure or elevated blood pressure during 2013 to 2016. An estimated 1.3 million youth ages 12 to 19 would have high blood pressure according to the new guidelines, or about 1 in 25 children. In a classroom of 30 youth, 1 person would have hypertension and about 3 more would have elevated blood pressure, according to the CDC. Recent American Heart Association heart disease and stroke statistics suggest that the number affected may be higher, estimating that 15% of adolescents have abnormal blood pressure. Causes of hypertension in children are both for primary hypertension and secondary hypertension. Primary hypertension occurs on its own without an identifiable cause. This type of high blood pressure occurs more often in children age 6 and older. Secondary hypertension is caused by another condition. It's more common in young children. Other causes of high blood pressure include chronic kidney disease, polycystic kidney disease, heart problems such as severe narrowing of the aorta, adrenal disorders, overactive thyroid, narrowing of the artery to the kidney, sleep disorders, especially obstructive sleep apnea, and certain drugs and medications. Risks for cardiovascular disease that start in childhood are more likely to carry over into adulthood. Youth who have cardiovascular disease risk factors, such as high blood pressure, obesity, and diabetes, are more likely to have those risk factors as adults, putting them at greater risk for heart disease and stroke. The risk factors for developing primary hypertension include being overweight or having obesity, having a family history of high blood pressure, having type 2 diabetes or a high fasting blood sugar level, having high cholesterol, eating too much salt, being Black or Hispanic, or being a male, smoking or exposure to secondhand smoke, and being sedentary. High blood pressure usually doesn't cause symptoms. However, signs and symptoms that might indicate a high blood pressure emergency or hypertensive crisis include headaches, seizures, vomiting, chest pain, a fast pounding or fluttering heartbeat or palpitations, shortness of breath, and blurred vision. Treatment options for hypertension in children are weight loss, indicated in obesity-related hypertension. Weight loss improves blood pressure in overweight adolescents. Salt sensitivity of blood pressure decreases other cardiovascular risk factors, dyslipidemia, and insulin resistance. Sodium restrictions. Increased sodium intake is associated with higher blood pressure at all ages. Current recommendations are for 4 to 8-year-olds to have 1.2 grams per day and children over the age of 8 to have 1.5 grams per day. Another treatment is physical activity. Regular physical activity is beneficial for preventing and treating hypertension. Improved fitness slows the progression of elevated blood pressure at 1 year. Studies suggest an effect of exercise on blood pressure reduction independent of weight loss. Indications for pharmacotherapy would be symptomatic hypertension, secondary hypertension, stage 2 hypertension, target organ damage, diabetes types 1 and 2, CKD, persistent hypertension despite non-pharmacological measures. Prevention of hypertension in children. High blood pressure can be prevented in children by making the same lifestyle changes that can help treat it. High blood pressure caused by another condition can sometimes be controlled or even prevented by managing the condition that's causing it. At wellness visits, children should have their provider measure their blood pressure starting at age 3. Helping children keep a healthy weight, eat nutritious foods, and get regular physical activity can lower their blood pressure and reduce their risk for cardiovascular disease later in life. Children should be offered nutritious, low-calorie foods such as fruits and vegetables in place of foods high in added sugars and solid fats. Children should be served more fruits and vegetables at meals and as snacks. Children should be provided foods that are low in sodium. Sodium raises blood pressure. Nearly 9 in 10 U.S. children eat more sodium than what is recommended. Make sure water is always available as a no-calorie alternative to sugary drinks and limit juice. Children should get the recommended amount of physical activity each day. There's many different age-appropriate activities that can help them get this required amount of activity. Parents should be aware of their child's growth. They can use the CDC's Child and Teen BMI calculator to screen children for potential weight issues. High blood pressure in youth is linked to health problems later in life. The good news is that it can be prevented and there are different ways that it can be managed. Please stop here for a moment to take a post-test to assess your knowledge of hypertension in children. The link is provided in this slide. This is a table that gives the different definitions of blood pressure categories and stages for children. And then also there is some information about different facts for high blood pressure in children and what blood pressure readings mean.